Northern Health addressing staffing shortages in Peace Region hospital diversions tonight. The health authority now saying things are improving despite 3 service interruptions this month. Jeff Cunha spoke with the VP of Clinical Operations and has the details.
We put in place a number of priority planning activities to help address what the actual underlying issue is, which is the shortage.
Promising words from Northern Health today following 4 years of chronic staffing shortages at Peace Region hospitals. The issue reaching a breaking point last year when there were 25 diversions in Chetwynd, double-digit interruptions in Dawson Creek, and in a single week last July, Fort St. John saw their ER closed for 5 consecutive nights. But now the health authority assuring the tide is turning.
We've recruited 900 net new employees. To the north, 450 of them were nurses. So we're seeing the nursing shortages decrease.
Those nurses distributed across northern BC. However, the health authority couldn't provide exact numbers on net nurse gains in the Peace region, only that they are being tracked.
There are still unintended diversions, short notice sick calls that come in, people for whatever reason who are unable to report to work, and it may result in a closure, but they are far less now than they were prior.
In 2021, former Health Minister Adrian Dix said he was open to an independent audit of Northern Health, contingent on a few things being done first. One of them, a change in hiring practices.
How we're onboarding people, what programs we're offering to try to get more local people who are already connected in the community and give them the ability to do the training.
The minister then backtracked his stance on an audit before leaving the position following an NDP cabinet shuffle post-October's provincial election. Sonata says recruitment and training remains ongoing. The $30,000 incentive program, retention bonuses, and training incentives are still in place. Northern Health to follow through with an agreement with the BC Nurses Union to have nurse-to-patient ratios in place within the next few years.
That will mean we need to recruit even more nurses because this is going to be a large influx of healthcare workers into our system.
However, it's not a promise that the diversions will stop.
We can always get better at how we do things, and that is something that we're looking at internally.
But a step in avoiding them.
The entire Northern Health family and team is working to ensure that we mitigate every closure.
Although Northern Health says they're doing everything they can to avoid hospital diversions, it couldn't have come at a worse time. Nearly 150 nurses, many of them from Northern Health, attending a rally in Vancouver today. They are demanding improved working conditions by having staffing shortages and safety issues addressed. Sonata saying she hears their concerns and retention remains a top priority. In Fort St. John, Jeff Cunha, CJDC-TV News.